My name is Sophia Mendenhall, and this is Broken Bonds, the impact of BPD on emotional relationships from the ages 14 to 30. Imagine waking up every day not knowing who you are or how you feel or if the people around you genuinely care. At the end of the day, you could be filled with love, rage, and frustration and emptiness. This is the reality for somebody with BPD. It's not just mood swings, it's being in a constant war with your own mind. This quote from Norberg's False Nostalgia talks about how forming strong emotional memories in adolescence and adulthood because of your first. And this could be your first job, your first girlfriend, boyfriend, your first friend. And this is the time of building your identity. But with somebody with BPD, the same moments could be filled with fear, self-doubt, and emotional chaos. While looking back at the time as emotional or exciting, for people with BPD, memories are filled with anxiety, self-doubt, and rejection. Intensity of these emotions can change how they see themselves and remember key events, which is a huge deal considering that this is the age where your emotional foundation is built. But what is borderline personality disorder? Borderline personality disorder is a mental health condition where you could have a hard time controlling and regulating your emotions, and this can cause sudden mood swings that are very harsh and rapid. They also struggle with fear of abandonment and relationship problems, and this could stem on a person that they heavily rely on, and this also affects the way they impulsively react. To what extent does borderline personality disorder contribute to a person's emotional relationships and their stability from 14 to 30? BPD has played a major role in relationships, and this is because of their intense mood swings, weak sense of identity, and impulsive behaviors. But the three major factors that cause the instability is emotional dysregulation, low self-esteem, and difficulties in brain functions that make it different from a regular human brain. These elements can create instability, and together they form a cycle that's hard to break without support or awareness. BPD leads to unstable relationships because of these three factors. When you can't really regulate your emotions, you become more reactive. When self-esteem constantly shifts, you rely on others for validation, and when your brain processes emotions differently from a regular brain, small arguments can become overwhelming. All of this makes relationships more difficult for people with BPD. And by understanding this, we can build better interventions and support to help with their emotional development. First, borderline personality disorder contributes to the instability of relationships because of emotional dysregulation. This quote by Navarro Gomez states that people with BPD in relationships have a more passive-aggressive way of communication and insecure attachment. This means that they can either latch on too hard or push people away out of abandonment fear. The second quote by Sebastian Burchard explains that people with BPD have a higher rate of breakups, and compared with non-clinical couples, clinical couples have lower marital satisfaction and higher attachment insecurity. This cycle of intensity and conflict and reconnection becomes a pattern, making it hard to build trust or emotional safety. These patterns of emotional chaos shows how people with BPD can't build regular emotional connections, and this can break down their communication. As you can see in this visual from the CBH Center, it shows how the relationship cycle is very common in BPD. It starts with intense idolization, where they can get overly attached right away, but quickly shift to anxiety and fear of rejection and emotional testing. By stage 4 and 5, they're constantly doubting the relationship, pulling away but trying to reconnect. This cycle reflects what I mentioned earlier. Emotional dysregulation makes relationships unpredictable and exhausting. The final stage is a full emotional crisis, which can lead to impulsive behavior or emotional shutdown. This cycle doesn't just hurt the person with BPD, it hurts the people around them as well. Borderline personality disorder contributes to instability in relationships because of unstable low self-esteem and misperception. In this quote by the Psychopathological and Behavioral Assessment, it states that people with BPD have a lack of emotional clarity and limited access to emotional regulation strategies. Somebody can feel confident until one comment or disagreement makes them spiral. This causes emotional overreactions and constant need for reassurance. When you don't get it, they can assume the worst. This second quote by Dorina Winter explains that people that suffer with BPD are prone to negative emotions such as self-disgust and shame. When self-esteem constantly crashes and people misread others' intentions, it can cause conflict and distance. In relationships, that is supportive. This emotional distortion ruins potential stability. It also creates feelings of isolation, which makes people with BPD more emotionally dependent on others, starting a dangerous cycle hard to escape. Lastly, the reason why borderline personality disorder causes instability in relationships is because of the neurological differences from the human brain. In this quote by Biological Psychiatry, it talks about how people that suffer borderline personality disorder display different neural dynamics. When you try to calm someone down or use strategies like distancing themselves emotionally, their brains don't cooperate the way a neurological brain can. This can lead to impulsive behaviors, especially during stress. This next quote from PsycNet explains that the data that they conducted with people with borderline personality disorder have significantly greater probability in reports of effective interrelational experiences. And this can cause to a more increased rate of impulsive behaviors. If the brain itself struggles to manage emotions, even therapy and support can't always prevent impulsive reactions. This biological factor makes emotional relationships unpredictable and hard to maintain. This shows that BPD isn't just a personal flaw, it's a mental health disorder that is rooted inside your brain and affects how it works. But what can we do? There are treatments. Dialectical behavior therapy, also known as DPD, is the most effective approach, and it teaches people with BPD how to manage their emotions, practice mindfulness, and communicate better. Early diagnosis is very important during teenage years, so they can get support before these patterns fully develop. The reality is not everybody has access to therapy. There's a huge stigma around BPD, and it's one of the most misunderstood disorders. Even with therapy, emotional instability makes it hard to commit long-term, so treatment has to be flexible, accessible, and long-term. That's why schools, families, and communities need to help, not just medical professionals. Emotional education and support should be a part of your everyday life, especially during these early years with people with BPD. Thank you.
All right, stay right there if you would. I got 2 questions for you. Bless you, by the way. First up, how valid and reliable were the sources that you used, and then how do you know they were?
I'd say that my sources were pretty reliable because the ones that I didn't use were ones that were more than 10 years back, and I used the correct browsers such as EBSCO and Google Scholar to find them, and they were all academic journals.
Okay, and if you had more time, what additional research would you conduct on this issue?
I really wanted to look for research that showed the success rates of the DPD on how to help people with borderline personality disorder, but I couldn't exactly find graph or rates for that.